Hello and welcome to Sheila Lives Out Loud. My name is Sheila Muigai. I'm so glad you found this channel. As always, please click subscribe and hit notifications if you haven't already. And be sure to drop us a comment in the comment section below. If you've seen something in this video and you know it's positive, you know it's going to make an impact, share it. It's always good to find a good thing, but it's even better when you share it. Okay? And especially in this season, we really are going through it as a people, as a nation, as a globe. We are citizens of the planet, and whatever is happening to us in the name of the COVID pandemic is affecting each and every single one of us. Maybe not to the same degree, but we all feel the effects of this pandemic. And the World Health Organization designated the year 2020 as the International Year of the Nurse and Midwife. In the midst of a COVID pandemic, how do you celebrate? What are we celebrating? How do we recognize, how do we honor our midwives and our nurses? And here to chat with me as we try to answer that question is the Regional Director for the SafeCare program with PharmAccess Foundation, an international recognition program amplifying quality and excellence in health service delivery. She sits on several boards. Amongst them, my guest serves on the advisory board for the Kenya Women and Children Wellness Center, the African Union's Private Sector Technical Working Group, and she is also currently a representative of the Kenya Ministry of Health Technical Working Group for Health Regulations, Quality and Safety and COVID-19 Human Resource Committee. Welcome, Karibu Sana, Faith Muigai. I'm so grateful that you made the time to sit and chat with me for a few minutes.
Asante, it's always an honor.
Now, you are one of the most passionate women when it comes to what you do. You're on fire, and that's in a good way. And being the year of the nurses, this is something very close to you. So in just, few words, just to understand what you do, where you're from, and why of all the people in this Kenya, I am sitting here to have this conversation with you. Tell us about, you know what it's like to be a nurse, and you know what it's like to build up from there.
Sheila, thank you. And I'm just so humbled for you having me. Why me? Because I'm the mad one. So I speak. Number one, this is the year of the nurse and the midwife. It was dedicated Florence Nightingale 200th birthday. But there are so many other matriarchs that we actually recognize at this juncture. Crimean War, pandemic, it was a public health situation. She was a statistician. She was a researcher. She put things into place that we're actually actualizing right now in terms of hand washing, social distancing, ventilation, light, very basic, but that came from that era. So let us not be fooled. One of the key women in our world actually put these things in place that we actually have to actualize right now in the midst of COVID. So as a nurse, I'm celebrating our matriarch and our matriarchs and patriarchs in this profession that is so profound and is actually the epicenter of the health care system. We are the ones who pull everyone together. We pull all industries together, and we actually virtualize what needs to happen, and we coordinate. We lead, and we drive policy and so on and so forth. So for me, I'm just so humbled. This is our year, but our year is in the midst of a pandemic. We're being tested again. But in this test, always in the state of crisis is opportunity. We are actually now in the place where we can show what we are worth. A nurse versus nursing. I'm not talking about nursing. I'm talking about a nurse and the midwife and the role that they play in transforming economies.
Right. When we think about nurses, especially living in a developing country and coming from Africa, our understanding and our perception of nurses, we do not give nurses the respect and the encouragement and the recognition that they deserve, because our perception of what a nurse does is very... It's almost, we need to change. There's a lot that we need to be very grateful for. And sometimes it will take you being hospitalized in a hospital to understand that a nurse is not just yule mama yule pale uko kwa corridor anapigia watu kelele. It's not that. It's far more. It's not the people who sometimes we see pushing back and forth with the government for more pay, and with good reason. There's a lot more that goes into being a nurse. So let's talk about that.
Thank you. Yes, there's a very shallow lens to my profession. And for me, as a regional director, I stand first clearly as a nurse. That's my first role. CEO, CEMO, regional director, all those fancy terms come afterwards.
Yeah.
Number two is that I was trained, I'm a professional, and I'm a licensed. Okay? So similar to a lawyer and a doctor and an engineer, I have a license that I have to adhere to, and there are tenants that I have to speak to and uphold that license. So I take that seriously, and we should take that seriously. Yes, there's a shallow lens in how we are perceived, and it's up to us to actually change that perception. And I think this year, as the year of the nurse, of the midwife, we have actually collated ourselves as communities to say, okay, it's time for us to be seen differently. It's actually unfortunate that we have to say this, but we are the ones where when people are vulnerable, they come to us. When people are vulnerable, they come to us, and then they remember us. But that's not a state I want nursing to be seen, because there are people in policy, administration, entrepreneurship, people opening businesses. If you look at my journey, it's totally a different story. So I think we need to start projecting the nurse and actually amplifying the nurse in a different way. And we haven't done that. And I also take credit for that, because we haven't done that for ourselves, because it's up to us to speak in terms of power. We do a lot of things, we don't document it. We do a lot of research, we don't document it. We actually leave other professions to document what we do. And so we're seen as subservient, right? And if you look at my power and I am not subservient. So for me, is actually even trying to get out to the world and say, we are not subservient. Yeah, we serve and we love to serve. We are compassionate and it's good. We are empathetic. Yeah, but there's a science around what we do, so that we are also academicians. Yeah, there's a thought process and theory to what we do, that it just doesn't come from the heart. It comes from the brain. Right. And I go back to Florence and saying statistician and researcher. Let's go back. There's a science to what we do, and it's powerful.
All right. Speaking about the science, two things are standing up for me in terms of questions for you. We're looking at foundations that were laid by a matriarch, and we're using them today. Far too many people will perceive nursing as a woman's field, and that is not quite the truth, because we do have male nurses. In fact, I remember one of my young nieces, I sat with her in the hospital, and her favorite nurse was a male nurse. He was just wonderful with her. So the perception of nurses can only be female, I'd like us to address that. And then also go to the academics of it. What does it take to be a nurse?
So I think traditionally we look at where we started, and yes, a female powerful woman started it, a profession, yes? But a profession is a profession, and anyone can go into it, female or male. So it's about the science around learning what we do and then delivering what we do. And anyone can do it, male or female. So for me, nursing is a profession. Qualifications, it's like any qualifications to be a legitimate professional, okay? I actually started out, and there's different pathways, and different professions have different pathways. I actually was able to be exposed in the developed world where there's actually lenses of progression. So I started out as a diploma or associate degree, went to my bachelor's, went to my master's, and are going to pursue my PhD, right? So what is the difference in that in any profession in terms of when you're trying to get education, there are different levels, and in those different levels and capacities, there are different tenants that are built into you in terms of technical leadership and so on. And so for me, I see nursing as any other profession in terms of you get your fundamentals, technical capabilities, and then you grow. And then in that growth, there's a lens of where you're growing. So you don't have to, as a PhD or as a master's, be a nurse on the clinical floor, because that's what everybody sees, is that you can explore different angles. I was in research, I was in administration, and so on and so forth. You look at our different industries in terms of Ministry of Education, agriculture, and so on, nutrition, sanitation. If you don't have a nurse, you look at our corporate world, occupational health and safety, if you don't have a nurse, right?
Yeah.
When we're talking about COVID, who do you need to advise you on the messages that need to go out in the community? Tell me, public health, nurse. So for me, I see ourselves spreading, transport, blah, blah, blah. And by the way, if all these industries fail, you end up in a hospital. Who takes care of you? It's a nurse. Epicenter. Epicenter.
You're the nerve center of it all, and it's time we begin to give you that recognition. You've mentioned the diversity, and for nurses, for those who are going into nursing, for those who already are in this field, when I listen to you, I'm hearing you're not just limited here. You've got the world at your feet. You can expand, you can push on what it is that you're skilled at doing, and not just be the person who I graduated, I came to this hospital, and I will retire in this hospital. It's so much more.
We self-limit, unfortunately. And so we're waiting to work in the Ministry of Health. And I actually challenge my fellow nurses. No, look broadly. Yeah, what you're doing, we can do. Right. And we can send messages in terms of even communication, entertainment, and so on. So we self-limit to think that we're going to have this cushy job in the Ministry of Health with a retirement plan and so on. So my biggest challenge to this profession is understand your value and then spread your reach. Because we are valuable. And this is what my exposure in other industries or other worlds, developing worlds, has shown me. We could plug and play in every industry, and in every industry we're so valuable. We are so valuable. But there's a self-limiting aspect that we here in Kenya I see, or Sub-Saharan Africa that I see. But then last week I actually was interviewing somebody who was the Minister of Health in Botswana, Sheila Tlau, a nurse.
It would be wonderful if it happens here, but you know what? It's not a question of if, it's a question of when. And to get to when, it begins with aligning. And in aligning, you look at where you find yourself and what's going on in the world around you. We're all dealing with COVID-19. Some of us are still in shock. Many are still in denial and living like, no. As long as I don't know anybody who has it, then it's a creation of someone, of something, of somewhere. But in this time, being a nurse is even more difficult. What kind of challenges are you seeing from the frontline with nurses, not just in Nairobi, but across Kenya?
Across the world is that we're not protected. We are losing people on the front line because our policies and governments have not prioritized us as being essential. So when we talk about PPEs, personal protective equipment, that should have been as a minimum standard in our healthcare facilities. They were not there. We were not prepared. And so we're sending soldiers to the battle unarmed. That is sad. We have lost a doctor yesterday. We have lost 2 nurses as well. And so as we advocate for the people who protect us and care about us on the front line, the challenge is we are not protected. We go home to families, right, at some point, because now there's quarantine, isolation, all these social distancing terms. So I'm working on the floor. And then at some point, I want to see my babies. When I go back home to my babies fear me because I'm carrying a disease or have been exposed to a disease. Okay? Mental health, psychosocial health is critical. We protect others and we have to protect ourselves. We are so giving in our profession, nurturing. We give of ourselves, but we tend to not remember ourselves as human beings. And so one of the things globally in this profession is taking care of ourselves. You actually had a series on psychosocial aspects of health and mental health, very critical, because in a pandemic, we forget that we are seeing grieving people, we are seeing dying people, we are seeing sick people, we are scared as we're exposing ourselves. And we need to talk to people, we need to hash that out to be able to arm ourselves up and then go back to the battlefield.
You've spoken to the challenges, you've spoken to the needs for healthcare workers, what you require. But you know, the life that we live is you can have a wish list and you can have the reality of it all. Right now, in many counties across Kenya, the travel ban has been lifted. And so we're all in flux. There are those who are leaving the city, and equally, there are those who are coming into the city. How in these times, and we're beginning to see the numbers going up, the honest question I have is, how do I help you? Because there's a systemic kind of assistance that comes, that trickles from the top, and it comes down from policy to procedure. But as an ordinary Kenyan today, it is the year of the nurse and the midwife. And I know you are on the front line. What do I, as Sheila, or my friend, or my mother, what do we do and pull together to help you as a community?
For me, I say, stop being socially irresponsible. That's my message to our Kenyans, because we did not lock down our country. It was halfway open, and then now I've opened it, okay? And so we're open to more risk. For me, to you, is communication. Reach our people at the ground level, our community leaders, our religious leaders, the ones who drive community, and send the message of just being socially responsible in terms of the things and the tenets that the government is trying to drive: social distancing, hand washing, use your mask. And the mask is not a headband or a thingy band.
A chin band.
A chin band. Yeah. The things the government is trying to drive are really critical, but sometimes people might think it's top down.
Yeah.
So for people like you who have a voice and access, I say spread the word so that it can get down to the community level and assist us in community health and public health in saying this is real, the numbers are going up, but we can prevent this if you take the caution that has been put to place.
Okay. In pushing and listening to you about the precautions and what we all can do, I remember speaking to Dr. Simon Kigondu from the Kenya Medical Association. Since March, I've been touching base with him anytime anything changes in terms of the lapse of travel bans and cessation and extension of cessation. We've been touching base with him to see what's the way forward, what can we expect. And now with these counties open and this traveling happening, one of the things he called for was for government to hire more healthcare specialists, to get more healthcare workers. Do you agree with him on that?
Simon and I sit on the same Human Resource for Health Task Force for the national government. So I cannot support him more, because right now, in terms of the human resource that we have, we're 50% short, right? And we're now trying to put in tenders to get other people on board, whereas this should have happened 3 months ago. So human resource for health, because when you're looking at the what is happening right now, even shifts and so on, people have to go on quarantine. So they're off shift, 2 weeks on, 2 weeks off, and so on. You have to cover that. When you talk about isolation beds, there's a minimal care that has to happen. That when you talk about ICU beds, you probably need 4 nurses to cover that in 1 day. We have 1 nurse covering that in 1 day. Yeah. So the numbers are critical, and it is time for governance to understand that healthcare professionals and them actually implementing what they do effectively talks to actually prioritizing who they are and what they do, and then accelerating the numbers, because we are going to have a surge. When we have that surge, it's not business as usual.
Mm.
And so have we prepared for business unusual? So I support Simon and Dr. Kigondu in what he's saying in terms of we don't have the numbers, we need the numbers.
Okay. Going back to the year of the nurse, and there are always marked celebrations, and there are things that people will do globally in different markets to salute and just give a nod to the healthcare practitioners or those who are being recognized. And this year, it's the midwife and the nurse. And in Kenya, the National Nurses Association of Kenya is championing several activities. So could you walk us through what's in the pipeline? What can we expect to see? Is there an M-Pesa number we donate? We are all connected. We are a community. We want to recognize you, and we want to also assist you, especially in this time.
So the National Nurses Association of Kenya is our professional association that really is guiding the scope of practice in what we do. They are part of the International Nursing Council, ICN, and therefore there's a global link to actually linking us with a global community in nursing. What we have done as co-chair of the Nursing Steering Committee with our chairman, Alfred Bobengo, we have tried to bring stakeholders together and actually have a theme around what we're trying to do now and ongoing. And the theme is REAR. It's remember the nurse, embrace the nurse, empower the nurse, and then reinvent the nurse. And then when we talk about the nurse, it's not nursing, but the nurse as a professional, and changing the perspective or the lens on how the world sees what we do. Let me not say the world, what Kenya sees what we do. And so it is the caregiver, it is the administrator, it's the academician, it's the entrepreneur. So the different and in terms of leadership and governance, we have nurses in policy and so on. So we're trying to project the lens of the multifaceted roles that a nurse plays in society and bridge those gaps. We have embarked on a theme or on a journey, and I thank organizations that we have partnered with, IMG, to actually help us in marketing and communicating and public relations, because we don't do that well ourselves. So we said we needed to partner with organizations that can help us tell our story in a way that articulates what we're trying to do effectively. And so this year we have joined on a sort of a media campaign or a public relations and communications campaign to actually articulate the different multifaceted roles that we play in society. And that's what we're doing as National Nurses Association of Kenya, where we have actually pulled public and private sector to and nursing leadership to actually say who we are, where we are, and where we want to go.
Right. And it's collaborations and partnerships and associations like these that further extend the nurse's role. It stops limiting the nurse to you only belong in the hospital. This is an amazing time for all of you. It's wonderful to speak with you and to hear the passion that you have for what you're doing. But for those who are watching and are on the front line, nurses and midwives, because babies still have to be born. In as much as we're all working from home, there are certain services that cannot continue. We cannot relegate and send to homes. We've got midwives and sadly, last week, the doctor who passed on was a gynecologist.
Yes.
What would you like to say to your fellow nurses and midwives, anyone who's watching and is just on the brink right now and is looking to be inspired again?
I think there's three things. First of all, protect yourself as you try and protect others. Don't lose sight of that. You are powerful. The second is nurses are the epicenter of the health system. Take power in that. In different levels, take power in that. The third thing and the last thing I'll say is nurses and midwives are key contributors to thriving economies. Right now, the decision to be open and closed, when, how, is up to us. because we are the ones on the front lines battling this battle, and it's up to us to communicate to our leaders the when. So we are key contributors and need to sit on the table in making these decisions. And most of the time, we're not. So we need to push our agenda forward and make sure that our citizens are safe, and then that you are safe.
Thank you so much, Faith. I've learned so much from you just listening to you speak. Lessons from 200 years ago with Florence Nightingale still hold true today. So if we keep doing the right things, if we keep taking care of each other, we've got a really good chance of making it through this and going after all those things that set us on fire as well. But in a good way, not that fire, but a good fire. Thank you for your time, Faith. It was lovely to speak with you. The door is open. We're here to work with the nurses and the midwives. Everybody, we do our bit. Whatever you need us to do, we are here for you. Thank you again for the time, and thank you for watching this episode. Please drop us a comment in the comment section below, and remember to share. There's information in this time, information, knowledge. That's power. That's how we stay alive. That's how we fight another day and keep each other going. Please remember to subscribe and hit notifications, and let's catch up and do this again next Monday. Until then, stay safe, stay sane, and live out loud. Bye for now. Bye, babe.